So hysterectomy is a procedure to remove the womb, and this includes the other structures attached to it. In most cases, we remove the womb, the neck of the womb, and both of the tubes. And depending on the condition and the woman's stage, you may want to consider whether removing the ovary is important. But basically, hysterectomy talks about removal of the womb tubes and the neck of the womb. There are many reasons why a woman may require hysterectomy. Commonly, it might be as a result of early stage ovarian cancer, endometrial cancer. That's why they're having hysterectomy. But also, they may have it for other non-cancer conditions. It could be due to heavy menstrual bleeding, where other treatment options have failed, and that's the only option left for the woman, which is very effective. It may also be that they've got other conditions on the ovary, and as part of the treatment for that, they need to have the womb removed. And it could be for cervical cancer, early stage. So yes, hysterectomy, it is possible for this condition, but of course, it can be done different ways. These days, because of the benefit of technology, it can be done via surgery, and that offers quicker recovery and less pain, less day in hospital for patients. But it may not be suitable for all patients. Therefore, you may need to still perform the procedure the traditional way, which is having a cut on the tummy. So you could either have a full hysterectomy or a partial hysterectomy. So a full hysterectomy means you're removing the womb and everything attached to it, particularly the tubes and the neck of the womb. Whilst a partial hysterectomy involves just removing the top of the womb and leaving the cervix behind. Like I said, whether you remove the ovary or not depends on the condition. So that's not usually something that must happen with hysterectomy, particularly in younger patients where you think about a risk of going through the change and the problems that comes with it. So that's the difference between having a full hysterectomy and a partial hysterectomy. But also, you can also do hysterectomy different ways, either surgery or either through the traditional way where you have a big cut on the tummy. And lastly, it can be done vaginally where there's no cut on the tummy at all. So hysterectomy, of course, is a big operation. And with every operation, there are risks. Some are common, some are less common, some are serious complications and uncommon, and some risks are quite rare as well. The common things that we talk about with hysterectomy would be pain, bleeding, infection, and the risk of a scarring or hernia where you make the incision. We also talk about risk of clots in the leg or lungs, and depending on the route of operation, either surgery or traditional, the risk might be higher depending on how long it takes for the woman to recover. But in terms of serious risk, you're worried about injury to the structures around the womb, like the bowel, the bladder, the major blood vessel, and the ureter, which I said is the part that connects the kidney to the bladder. Very rare complications would include a return to theater, and as a result of bleeding after the operation, or if the woman develops an infection and there's a collection in the pelvis that needs to be drained for her to get better. And of course, we don't talk about it, but the risk of death is very rare. But it's something that needs to be noted as part of the discussion regarding the complications that can happen with hysterectomy. So it is a major operation. So definitely there will be some days which are quite rough, but as the weeks go by, you generally see that you're getting back to normal activities which were done before the procedure was performed. But we normally say to take it easy after the operation. And of course, this is where you need support at home with lifting, handling, and things like that. And of course, as you get, it's also important to mobilize to also reduce the risk of clots in the leg or lungs. And usually by 4 to 6 weeks, most women are able to do the things that they were doing before surgery. And by 3 months, more or less, everybody's back to normal in terms of the functions they were doing before they had the procedure done. Good question. It all depends on the condition. So for most women who are not, who have not been through the change and are having problems with their periods, there are other things which you can consider which are not as invasive as a hysterectomy. And it could be things as simple as taking tablets with our hormones to reduce the bleeding when they come on their period, or consideration for hormonal medication, which actually might be more effective. And most women perhaps would want to consider the hormone-coated coil, which offers better, more effective treatment for reducing the periods and also acts as a contraception. And for some women that the family is complete, they may want to consider a procedure called endometrial ablation, where you burn or destroy the lining of the womb. And as a result, there's little or no bleeding as a result of scarring of the lining of the womb. And in all cases, doing nothing is always an option. And when nothing is done, of course, the condition may not improve. But usually when women go through the change, the period will stop naturally. And therefore, they do require a hysterectomy. Well, in cases of cancer, it all depends on the stage of cancer, but most early stage womb cancer can be treated with hysterectomy.